Are private clinics a viable solution to Canada's healthcare crisis?
I don't think that would be the solution. I think offering people better wages and more jobs would be the solution because there is a lot of gaps that need to be filled.
Great answer. And yourself?
With my experience with private clinics, it's not the solution. I think they're too expensive. Like most insurance don't cover private places, and most people don't have insurance, so.
I would rather that we built up our own system. I don't see the benefit of it, and they certainly get funded at levels that certainly our regular system does not, so I'm not a huge fan.
I think it depends on what the private clinic will be specifically used for. Personally, I think that public healthcare could be like a better use of resources, but I mean, I guess it would depend on how the government is using those funds to have like, I would say like a proper public healthcare and not necessarily like any kind of system. Because right now I've been hearing that the hospitals aren't doing that great, and we would like to see that be a little better.
No. In my opinion, I think private healthcare is probably one of those things that is more detrimental than it is beneficial. Like if we look at other countries, mainly the States, who have private healthcare systems, you can see just how much of a necessity healthcare is and how many people don't get it. So I think implementing private clinics in this country would probably be a detriment.
Half the clinics here don't even work. If you're not a patient on their list, you're not being seen. My family doctor, for one, I can't even get a hold of. So I don't think that's necessarily going to help all that much, you know? I mean, maybe for people that can afford it.
I was just in the United States for a month, and every single person I met there said, "Oh, we wish we had your system in Canada."
Yes, there's no other way. I mean, you need help, you need help. If it's going to, unfortunately, if it's going to cost a little money, then it's going to cost a little money, but at least you're getting your health care.
I think healthcare is a basic human right that we should all have access to, and we really need to be investing in Canada's healthcare system more. You hear about what happens in the States where getting some cancer or something like that, if you're not properly insured, can destroy a family or destroy a life. And I just don't think that's the direction Canada should be going into.
Yes and no.
Why yes and no?
Yes, because they create a new way to get people healed. But at the same time, with the amount of taxes we pay in Canada, we should be able to get proper medicine without having to pay for it.
Yes.
Why?
Well, because the system is in a crisis right now, and I think more people should be able to pay for whatever they can afford. If ever, this would represent something extra and take a little bit of the burden of the health system right now.
Never.
Why?
Because you shouldn't have to pay for your care, and there's so many people that are left out of the ability to afford any specialized care, and in BC, I think that's really important. We've relied on public services in the hospital and drop-in clinics, and they're doing good as far as having different, it's not just walk-in, but we're actually creating another level of care clinics, and it's working out really well.
Okay, and what about you? What do you think?
Oh no, I think it's a terrible idea because all it does is create a further division between those that have money and those that are low income, and then their care is different, their health is different, and it just creates a bigger divide around. And universal health care is something Canada's supposed to be proud of, not something we need to get rid of.
I've been asked that question many times. Like, private clinics are available about 80 miles to the south, so you can go there, or if you want to bring them here, that's a debate. I mean, we already have a two-tier system. If people who can fly to Seattle or Bellingham, they have access to healthcare, alternative healthcare, anytime they want.
Yes.
So why or why not?
Well, to give people an option, and it would, people who can afford it can do it, and then there's more room for the people who are. Yes, I would absolutely go for that, yes.
I don't know if I have the knowledge to answer that. to be honest. If they are, great. If they aren't, then let's stay away from them. There's so much mess and so much distrust in the information, unfortunately, these days. I would love to see a comprehensive study done. Logically, if you can open up more beds and it expedites the process, great. And obviously there's concerns about people who can't afford that being left behind, which I don't think is the Canadian healthcare system that most Canadians want. I know it's certainly not the one that I want, but anything we can do to alleviate the pressure at this point feels like is what needs to be done.
I grew up in California, and even though I'm a Canadian, and private health care in the U.S. is a mess. It is destructive to society. I think that private healthcare has a place to play in the public system to offset the needs today, but at the end of the day, a public system is more fair for the community and for individuals as a whole.